Our best bet is on sensory integration for children with autism spectrum disorder to increase participation by Sarah Brown, Courtney Rogers, and Tayler Saxton.
Joel is a 5-year-old Caucasian male who has been diagnosed with autism spectrum disorder. He attends preschool and is in a self-contained classroom with 7 children and 3 teachers. He displays poor social participation skills such as fighting with other children, his sister, and his mother. He does not like his peers in his personal space, and he often resorts to physical harm. As a result of his behavior, his mother has a difficult time taking him out in public to engage in age-appropriate activities. He displays sensory-seeking behavior such as crashing into walls, climbing onto furniture, and stomping with great force. Joel has problems pertaining to ADL such as bathing, dressing, and eating, and he does not like to take a bath or have his hair washed.
Our evidence-based occupational therapy question is sensory integration a beneficial intervention for improving social participation in a 5-year-old boy with autism spectrum disorder?
4 Level 1 articles were appraised to help answer the evidence-based practice question presented. Studies suggest that there is a need for more research on sensory integration therapy in children with autism spectrum disorder due to the various outcomes that the studies identify. Various outcomes suggested that sensory integration therapy is associated with positive effects such as decreased autistic mannerisms, improved self-care, and improved social function and participation. Level 2 research was not included because it did not specifically address the evidence-based practice question.
3 single-subject designs and 1 qualitative study was appraised to help answer the evidence-based practice question. Studies link changes in behavior and participation to changes in a child's ability to process and integrate sensory information. Outcomes of sensory integration interventions include, but are not limited to, improved social skills, the ability to initiate and lead conversations, improved social awareness and interactions, and greater frequency and complexity of interactions with others. Level 3 and 5 research was not included due to the relatively new rise in sensory integration therapy.
Sensory integration therapy is a beneficial intervention for school-age children diagnosed with autism spectrum disorder to improve social participation. However, the extent of the effectiveness needs further research. Level 1 research studies concluded that sensory integrative therapy is becoming a valuable intervention for occupational therapy practitioners. Level 5 studies and a qualitative study indicates that sensory integration can improve conversations, social awareness, interactions, and frequency and social participation of children diagnosed with autism spectrum disorder. This chart summarizes where we found our evidence. Databases include OT Seeker, CINAHL, OT Search, and Medline.
The inclusion criteria included children between the ages of 3 and 12 years old, diagnosis of autism spectrum disorder, and participants present with sensory deficits that impact social participation. Our exclusion criteria included adults with autism or sensory integration deficits, and then studies including only female participants.
Results of our search include 4 Level 1 research articles, 3 Level 4 research articles, and 1 qualitative study.
Our first Level 1 research article is a systematic review of sensory processing interventions for children with autism spectrum disorders. This systematic review examined the research evidence of 2 forms of sensory interventions, sensory integration therapy and sensory-based intervention, for children with autism spectrum disorders. The main focus addressed self-regulation and behavior as a direct role in participation in social situations. The participants were children who ranged from 3 to 21 years old and were diagnosed with autism, which meets our evidence-based question requirements. The results concluded that the SIT intervention had a positive effect on decreasing autistic mannerisms, improving self-care, and improving social function. However, these results were based on a small sample size, so further research was recommended.
Our second Level 1 research article is a systematic review that consists of 27 studies that look at the effectiveness of sensory integration interventions with children who have difficulty processing and integrating sensory information in order to participate in desired occupations. Although the article did not specifically focus on autism spectrum disorder, it addressed our evidence-based practice question through the use of sensory integration interventions to improve social participation in children who have difficulty processing sensory information. The systematic review informs clinicians about outcome measures of sensory integration and suggests that there is, in fact, a trend towards positive evidence that supports the sensory integration approach.
Our third Level 1 research article is the effectiveness of sensory integration interventions in children with autism spectrum disorders, a pilot study. The purpose was to address the effectiveness of sensory integration interventions for children with autism. The children ranged in age from 6 to 12 years old, with the majority of the participants being male with a diagnosis of autism. The intervention group received sensory integration-based intervention, while the control group received OT-based fine motor interventions. In the sensory integration intervention group, significant changes in autistic mannerisms were noted. However, social participation was not indicated, thus further research is needed to determine the importance of sensory integration therapy in improving social participation.
Our fourth Level 1 research article is a systematic review of sensory integration interventions and sensory-based interventions with children diagnosed with autism spectrum disorder, ages 3 to 12. Results indicate that sensory integration therapies improve daily activities and occupations in children with autism. Although not directly related to social participation, this review describes the effectiveness of these two intervention strategies on improving independence in children with autism. It was determined that studies varied too significantly in outcome measures for meta-analysis to be justified. Further research should be conducted to determine effectiveness on social participation specifically, rather than only performance in daily activities. Our first Level 4 research evidence is a single-subject study that looks at the effectiveness of integrating therapy ball chairs during circle time to improve participation in children with autism spectrum disorder. For the intervention, children were videotaped during circle time while sitting on the therapy ball chairs to collect data on whether this improved their class behavior. Outcomes revealed that overall, children showed improvement in engagement and in-seat behavior during circle time, indicating that applying sensory techniques with children with autism are beneficial in increasing participation. Although the study had a small sample size, making it difficult to generalize to this population as a whole.
Our second Level 4 research article is on a single-subject study exploring effectiveness of sensory integration occupational therapy interventions on functional behaviors of two children with autism spectrum disorder. Both participants show sensory integration deficits and limited social skills, characteristics similar to our evidence-based practice question. The treatment intervention took place in a clinic with an occupational therapist. Outcomes indicated improved social participation in both participants through the use of sensory integration therapy, including the ability to initiate and lead conversations, improve social awareness and interaction, and improve frequency and complexity of interactions.
Our third Level 4 research article is a single-subject article examining changes in adaptive behaviors and participation during an intensive occupational therapy sensory integrative intervention. The participant in the study is a 5-year-old and 5-month-old boy who has been diagnosed with autism spectrum disorder. Concerns for participation within the study includes high activity levels, distractibility, impulsivity, and clumsiness. The participant was described as a safety risk on the playground and at home. An intensive occupational therapy program using sensory integration for 30 sessions over 10 weeks was implemented. The interventions included swinging and prone while propelling on the floor by pulling a rope, working and prone on a mat, and introducing sensory challenges that the child needed to discriminate body sensations. This study links changes in behavior and participation to changes in the ability to process and integrate sensory information.
The last research article is a qualitative research study of parent perspectives of occupational therapy using a sensory integration approach. The study's purpose explored the parent's perspective in regards to their children's participation in occupational therapy services using a sensory integrative approach. By illuminating the views of the parents, 3 major themes were found to be pertinent to the children in relation to the sensory integration intervention. These included social participation, self-regulation, and perceived competence. The participants were parents of children 4 to 10 years of age who had a documented diagnosis of some type of sensory integration dysfunction. After examining the data gathered from the study, the results indicate that many parents described observable changes in their children after using the sensory integration intervention approach, including their ability to engage in activities related to social participation.
Implications include continuing education classes or an intensive program for those who want to specialize in sensory integration therapy. Research indicates that occupational therapists should implement sensory integration techniques in conjunction with other therapy approaches and treatment for individuals with sensory processing difficulties, including children diagnosed with autism.
Further research should be conducted on the benefits of sensory integration therapy in order to justify reasoning for implementing this technique within occupational therapy interventions. Research studies focusing on benefits of sensory integration in conjunction with other occupational therapy treatment techniques should be addressed. Further identification on populations who would most benefit from sensory integration therapy can help to define how sensory integration helps benefit individuals with different diagnoses.